Hey, good morning. Good morning, everyone. As you probably just heard, we are recording this morning, but it's my pleasure to welcome you on behalf of the Greenwich United Way Community Planning Council. My name is Joey Hessel, and I serve on the board of directors and currently chair this monthly meeting. I'd like to thank Jeremy and Rob for being with us. They're our fabulous executive team from Greenwich United Way. And today we have two distinguished guests, and let me just briefly introduce them from the random facts that I either obtained from them directly or online, and then we'll provide time for each of them to introduce more about what they do before we move on to questions. So first, I'd like to introduce and welcome John Mastronardi. Did I say that right?
You did.
Okay,
Most
good.
people don't get that on the first try.
It says the way it's spelled, but it's just a long name. But welcome, John. John is the executive director at Nathaniel Witherall and is an adjunct professor at Pace, at least according to a website that I read. Has a master's of public administration from there as well, and prior to that received a bachelor's in behavior science health informatics, which I've never heard of, from Mercy College. So looking forward to hearing a little bit more about that. And then we have Donna Spellman. Welcome. She is from River House, executive director. She has a master's in counseling and has dedicated her career to human services with a focus on independent living. She is an avid runner and just shared with me that every summer from Memorial Day to Labor Day, every day she runs a 5K and dedicates it to one of the residents as a way to bring awareness to them as people, to see them. So I'm very impressed by not just your dedication, but that amount of running in one season. Anyway, we are thrilled to have you both. So I'm just going to pause now and ask John to just share a little bit more about your role and responsibilities at Witherall.
Sure. Thanks so much. As you said, I'm the executive director at Nathaniel Witherall. I'm responsible for the day-to-day operations of the facility and its services. I lead the team, the facility staff, and that includes actively hiring, training, evaluating programs and services. It also includes overseeing our finances and budget, reimbursement, and I report to a board level governance, so otherwise known as chief cook and bottle washer.
Those are probably the hardest jobs. And Donna, if you wouldn't mind sharing a little bit more in detail about your role and responsibilities.
Sure. I'm Donna Spellman. I'm the executive director at River House Adult Day Center. We're located in Coscob, right on the Mianus River. So my role here is kind of twofold. I mean, I have executive oversight, administrative oversight for the organization. I also have the opportunity, and I see it as an opportunity to be very hands-on in my role. I wear the social worker hat here at River House, and the reason that I see that as being a true benefit is that I really, from a first hands-on perspective, get to know each and every family that is enrolled in our program, or even just receiving community support. So it really keeps me current and honest about what we're doing and why we're doing it, and ways that we could be doing more or doing things differently or better. So I'm sort of program and administrative at the same time.
I sense a recurring theme of the multi-layered executive director job description, whether it's washing or or anything else. It just shows your dedication. So we have a few prepared questions. The first of which is pretty simple. So we're going to start with John and then move to Donna. Asking each of you to please provide an overview of the services that your institution offers. And in particular, John, there's been a lot of coverage lately in the press of Nathaniel Witherall, and if you could also please share some of the positive changes that have recently happened.
Sure. So like many skilled nursing facilities, we do provide skilled nursing, orthopedic care. So that would be surgical aftercare. So for example, if someone had a hip or knee, shoulder, joint surgery, we would provide ortho care after that surgery and then get them home healthy and happy, hopefully. General medical care for end-stage renal disease, cancer recovery, arthritis care, sepsis management, IV therapy, cardiac and pulmonary, which would be if somebody's recuperating after heart surgery or, God forbid, a heart attack, congestive heart failure, anything like that. Neurological services, so rehab after back surgery or a spinal cord injury or a stroke. And we do outpatient rehab as well. Physical, occupational, and speech therapy on an outpatient basis. And you were asking, about us in the news, right? Mm-hmm. So the good news is that we're healthier financially. And I think that's sort of been going back and forth. A lot of voices, pro and con, in the town of Greenwich. And how we got there was we had to make some reorganization changes for some of our staff, cutting overtime. And one of the big ones was renegotiating and managing some of our larger vendor contracts, and streamlining our purchasing process. All very, what I like to say is unglamorous stuff, but it really does help the bottom line. And for the folks that sometimes will say, well, you're interested in the money. It's not the money. It's what having a healthier bottom line can provide our residents. That's the reason that we do what we do. So that part is the good news. A lot of challenges that everybody is really well aware of with staffing. Every single part of our organization and everybody else's, from nursing to dietary to housekeeping, we are truly challenged with getting qualified workers into those slots. People are really reconsidering post-pandemic, hopefully, the things that they're doing with their lives, their careers. And so we try our best to entice them with perks, with better salaries, just better benefits. And so, as I said, I will get more into what we're going to do with that healthier bottom line as we go through our presentation.
Fantastic. And John, I think all of us can empathize with your need for excellent staff and with the need for cleaning house and creating new infrastructure to support your future programming and the way that you're moving forward. Donna.
Sure. So River House, in our title, our title says what we do. We are an adult daycare center. And what does that mean? We are a medical model. In plain English, what that means is that we're a healthcare center that provides daytime care and support to older adults who otherwise would struggle to be on their own. These are adults. More than 85% of our clientele have a dementia-related diagnosis, as an example. People have cognitive and physical challenges, but could otherwise be home and sleep in the comfort of their own homes. The vast majority of our participants have families and family members who they return home to. We provide door-to-door daily transportation. our goal, it's funny, if you ask me, our goal is to make sure that they are safe and well cared for and have everything that they need. If you ask any of our seniors, what is it that you like about River House and why do you come? It's to see their friends, because one of the main goals is to break down or eliminate social isolation. So they have a purpose. They have a place to come every day where they see the people that they enjoy seeing each day. They participate in fantastic activities, exercise, music, horticulture, dance programs, current events. I mean, because we're getting older doesn't mean that we become disconnected, and doesn't mean that we lose our interest in life and in staying well. So here our focus is about what people can do. We celebrate what they can do. It's not about the struggles. And so we always have a variety of activities every day, and we let people choose. We're very much about self-advocacy and that dignity of being able to decide what would I like to do. And so people make the choice, choose the activities that they want to do. And we try to offer activities where everybody will be successful. They have enough challenges in their lives. It's hard to get older. Things hurt, things ache, things that we could ordinarily do perhaps provide some struggles. And so here we try to create an environment where people feel really successful. And that's basically us. We have 2 full-time nurses, registered nurses. We have 4 full-time certified nurses aides. We have a staff of 4 therapeutic recreation specialists. I mentioned that I am the social service or social worker here. So in addition to our health program and our recreation program, my focus here is caregiver support. That's who we are. That's what we do. We're a private nonprofit. We are a United Way supported organization, and we're very grateful for that.
We're grateful to have you in town, certainly. And I appreciate at the end, you mentioned that you also provide caregiver support. I think that is something that is often sadly overlooked. And also I appreciate the focus and spotlight on autonomy and choice, which I think is very empowering to anyone.
Thank you.
Okay, so now we're going to talk about sort of the impacts of this lovely pandemic. The senior care industry has had to navigate tremendous challenges over the past year, from staffing shortages, like John mentioned, and the demands of the COVID-19 pandemic. Last year has not been easy. So while advancements like the COVID vaccines have brought some relief to these challenges, the senior care industry will face many more challenges as we move into 2022 and beyond. What are some of the biggest challenges you're facing, and how do you plan to address them moving forward? So why don't we start with Donna, and then we'll go to John.
Sure. I would say, well, first, let me just start with saying that River House is a member of the Connecticut Association of Adult Day Services. And throughout, right now, currently we have 41 to be exact, member agencies throughout the state of Connecticut. And I serve on the board of the Connecticut Association, and I can tell you that no adult daycare center in Connecticut, 0, including River House, has ever had a COVID-19 outbreak, ever, not since day one. That doesn't mean that a person here and there, I will say myself included, didn't test positive at one point or another, but no center has ever had a spread. And that's because we have followed CDC guidelines. We've worked extremely hard to do everything that we know how to do. And I mean, I think I know the CDC website better than I know the River House website at this point. It's not by luck, it's by really hard work. So, you know, that is what really kind of continues to dictate how we move forward. Our biggest threat is fear. It's the fear of the unknown. You know, we were doing great. We were building back and our numbers were looking great, and all the people who had kind of taken a break for a little while were returning, and we were getting new people, and it was just terrific. And then the Delta variant, and then Omicron, and what happens is that people, understandably so, become fearful. We all become fearful. And so for us, the biggest challenge is this roller coaster ride of the up and down. The good news is that as these roller coaster rides continue, we're learning more, and there are additional best practices, and we're not under a rock, and we're listening, and we're participating, and we're hearing the guidance. So we do what we can. Our staff is here no matter what, because on one day we can have 30 people here, on another day we can have 18 people here, and we don't know from day to day, because we don't know what that call is going to be in the morning. And so, we're operating at full speed ahead. So it does affect our bottom line. I mean, if we don't have clients here, it definitely affects our bottom line. But we have to stay the course. And so we just, for us, the way we see it, we have no choice. Our community needs us. And we're mission focused, and we're going to be here, and we're going to make it through this. But for us, the biggest threat is the costs associated with the fear, because anybody can, understandably so, be fearful and decide to take a week off until things simmer down, or 2 weeks, or even a month. And we can't wrong them for that. And we're going to continue to hold somebody's spot, because they need us when they're ready to come back. But that's really our threat, is unknown.
Yeah, I can appreciate that. John?
Well, I mean, there's not a lot I can add to what Donna just said. So much of what you said, Donna, is what we've experienced and have been experiencing at Nathaniel Witherall. It's the same push and pull, the same angst from lots of different places. So you've got clearly our residents, our staff, family members, so many people that have a vested interest and love for the people that we take care of. But lots of times, what ends up happening is those competing interests end up having different ideas about the way that either regulations are interpreted, or the way that we're interpreting regulations. And it's hard to tell someone that at the height of the pandemic, and hopefully I can say that, at the height of it, it was really, really difficult to tell family members, well, no, there are restrictions to visitation. There are things that we can't allow to happen. Plus, trying to make sure that our residents weren't feeling isolated, that they were engaged, and so much of that is congregate when things are normal, but they weren't normal. So we had to figure out ways to do that, whether it be on the nursing floors, which is typically what we did with social distancing. All of those same challenges and stressors, because lots of times when you're doing things right and you're trying to make sure that people are safe, some people get very upset over that, because I totally understand that too. They want to see their loved one, but at the same time, I'm tasked along with the rest of our team to make sure that our residents stay safe, and that's been such a hard thing, to really look at people that either have felt isolated, that have felt, and that's also family members too, and to tell them, either give them that kind of news that you're not going to be happy about this, but this is what we're doing to try to keep our residents and our staff safe. And the same things that Donna said too. The sort of roller coaster ride of having a fully staffed kitchen, for example, one day, and then you've got to close down the cafe because people have called, you don't have enough staff. And it literally is like that from day to day, even now. And those waves, when we thought we were out of it, we were kind of like seeing light at the end of the tunnel, hoping it wasn't an oncoming train, and then Delta. And then, you know, we kind of got through that. And then it was the Omicron variant. So, yeah, I mean, I know I went on, but I couldn't have said it any better than Donna. So many parallels.
And I'm sure that many of us on this Zoom call, I see names of people I recognize from various departments and organizations in our town, can appreciate and empathize very significantly with what you both are saying about the roller coaster, as John put it, from day to day. Part of it is the psychological perspective that each person has that's subjective to only them. And if they perceive that it's not a safe situation and don't go to work, you can't fault them. But if they come to work, that's great. And you just never know from day to day who's showing up in terms of clients and who's showing up in terms of staff. So we really appreciate all of the dancing that you and your staff members do to keep everyone safe and to pursue your mission. I know it's not easy. So what changes have you made and will you continue to make to ensure healthy and safe activities, social events, and bringing in visitors at your organizations? How have wellness programs changed over the years at your organizations? So John, if you want to start with that.
Yeah, sure. Well, you know, we did use the same way that professionally we're using Zoom and other virtual meeting apps. We've done that with family members, loved ones, friends, and that of course is going to continue. And I'm sure we'll get deeper into a little bit of the technology, you know, as far as telehealth is concerned, because that's here to stay. And I only imagine that that's going to become expanded as a way to you know, help provide care and decrease isolation, and also, you know, make residents feel like they can meet with their primary care physician, even virtually, as well as their loved ones. So there's that. You know, we do teaching kitchens. We do different musical concerts. During the holidays, we did holiday crafts, and we actually didn't do a full congregate holiday gathering just because, you know, it was the same kind of a thing. We got guidance from CMS, CDC, DPH, and we decided to have small gatherings of, you know, holiday celebrations. So we broke it up that way. Resident poetry readings, and we do weekly movie clubs, art classes, ice cream socials, cooking demonstrations, and we always have live music entertainment on different floors as well. And you know, folks can see on our monthly calendar of events. We post that on our website in the events and newsletter section. So yeah, we continue to do the same things that we've always done, just in different ways. And again, sometimes folks understand that, sometimes folks don't. But again, that's where you're having these competing forces. You've got governmental forces telling you you can't have a big congregate group setting. So you've got to figure out ways to make it small and keep people safe. And then you've got, you know, either residents or family members that will say, you know, we want to have a big gathering, and you've got to kind of compromise and try to meet in the middle and help people to understand that. Yeah,
not an easy position to be in, I'm sure. Donna.
You know, for us, so much of the experience of Adult Day is a live experience. You know, I mentioned before that so many of our folks that attend have a dementia-related diagnosis. So in the first 3 months, back in 2020, the first 3 months of COVID, when the world basically shut down, we had switched to doing everything virtually, but we were Zooming and doing activities and things like that with our families, but we were hearing loud and clear, and we could see on Zoom that it doesn't work for our population. It's confusing, and just the ability to focus, and the caregivers got a lot out of it, but the clients themselves, it was confusing, and some were okay, but most not. And so that's why we came back live so quickly. So, what are we doing now, and how are we dealing with it? Well, for starters, we very quickly, as soon as that vaccine came out, we became a fully vaccinated facility. And I cannot say enough about my team here, because I had no problem. I mean, I can say that, yeah, it's mandated, but I've never had to impose a quote unquote mandate, because my staff, it's every time somebody got vaccinated, it was a celebration. We were all thrilled. And the same thing with the boosters. We all became fully, we're triply vaxxed, as we say, as is our entire client population. So that's how we're managing. We all, all day we're fully masked. We have masks. The town has been phenomenal with us. The United Way has been phenomenal, providing masks, tests. Everybody is tested constantly. I mean, for the longest time, we were doing on-site PCR tests on a weekly basis. Now that rapid tests are so readily available, we have a schedule, so we do random tests, but there's at least 4 tests being done a day to make sure that everything is okay. We're going to stay with that, and here's an interesting thing. Although the CDC is starting to hint that perhaps in fully vaccinated facilities, perhaps we could consider taking our masks off, I have a staff meeting at the end of every day. And my first thing that I do is to check in with the staff and say, so if that were to be, how do you all feel about that? And I have a good number of my staff saying that we feel more comfortable keeping the masks on. So you know what? Until the staff feels comfortable taking the masks off, we're staying the course. The masks stay on. I have to, it's my job to take care of everybody, and the staff is up there on the top of the list. So, that's how we continue on, is we just continue to do everything that we can. We were very fortunate last year. In July, we were able to have a live special event fundraiser. It literally happened about 2 weeks before the Delta variant became a thing. So we got in just under the wire, and I got to tell you, I'm keeping my fingers crossed, but we have a live event scheduled for April 29th. And we're going to tent it so that if there's more of a need to be outside and under the tent, it's happening here at River House, but we have the space to do it, and we've already arranged for a tent. So we, like everybody else on this Zoom, we all feel the need to be in person with each other, and that includes our caregivers as well. So, for a while we had said only clients and staff could be in the building. But our caregivers, because we know that they're fully vaccinated as well, that's part of the equation, we're welcoming them into the building. Our nurses screen at the door, so they're catching if anybody looks symptomatic, they're quickly pulling them in to do a test, or if anybody has symptoms, we assume that, test or not, let's get you home and isolated. And, so, and that's per the CDC. If somebody has symptoms, assume they're positive. So we're doing all of that. Health screenings it's how we roll. But and in terms of volunteers, again, if volunteers are fully vaccinated and they're, providing us with negative tests, come on in, join us, because they need it too. Like, we all need to move forward, and we can do it safely, and we have figured out how to do it safely.
Thank you so much. I'm actually going to jump around on my list of questions, because you both have mentioned technology a few times, so I figured this links to that. So obviously you've mentioned that there's been an increase in the role of technology. whether through virtual visits, telehealth, voice assistance, et cetera, in the services you provide to help build senior independence. But it also, as we know, can create some challenges. So what are your thoughts on the role technology plays with older adults? And how do you plan to use senior-friendly technology at your organizations? So, John, do you want to go ahead and take a stab?
Sure. You know, we've been, I have to say, challenged, at least at the beginning, with the use of technology. There were a lot of folks, family members, who, you know, they wanted either Alexa or something like it. And then, you know, I had to do my own research, and our staff did our own research, because we've also got to abide by HIPAA. And so there weren't lots of HIPAA compliant devices. I'm very happy, though, that they've since kind of relaxed those restrictions. So, you know, I think that something like Alexa or, you know, any of the Google devices, I think it's a great start for our residents and their family members connect, for folks that, you know, might have difficulty with either, you know, using the phone, you know, physical difficulty. Voice activated devices are a really great start to that kind of connection with family members and staying connected. I also think that expanding on that technology, as I had said before, I think part of that is what we're doing now with telehealth. We're just starting to use that and expand on that. And again, there's not only a clinical component to it, where somebody doesn't have to go out to the doctor office or the clinic. You know, they can meet with their doctor virtually. Does that take the place of, you know, a person-to-person, face-to-face? No, absolutely not. But it really can help if you've got someone who's telemonitoring a resident or a patient, and they can say, okay, we don't need to send them out to the hospital and, you know, go through that angst and that difficulty when somebody goes out to the hospital. A lot of folks don't realize those kinds of changes for anybody, no matter what their age is. They're really unsettling. They're really disturbing, and they can cause a lot of trauma and post-trauma. So using the technology in that way to kind of circumvent, if at all possible, the need to go to the hospital, and seeing a physician virtually and treating in place is, you know, also I think a big component of, you know, what will be coming and being expanded on in the future.
Sure. Thank you. Donna?
Yeah, you know, as I mentioned before, it's a little bit twofold, you know, for our caregivers, and particularly for those caregivers who are adult children who are caring for a parent or their parents. You know, many of them are working and, you know, kind of, you know, sandwiched in and on all ends. For them, technology has been a blessing. You know, on a very practical basis, you know, look at all of us who are at this meeting, and we can connect on and we can have a hard stop and get to the next thing that we need to get to. And it's convenient, you know, it's definitely convenient. But again, for those older adults who are here at our center, we have to be really sensitive about their needs and what they understand and how much they can get. I will tell you that a big push that I have right now, and I know we're going to talk a little bit about housing, and as you know, I'm really all about independent living. So a big push that I have, that a big campaign that I'm kind of working on is, John mentioned Alexa, using some of the newer technologies for emergency alert systems and making sure that people are well outfitted and know how to use that, because you'd be surprised how many people refuse to wear the pendant or a bracelet or whatever, you know, it's pride, it's a whole lot of things, or they forget to even you know, press the button. Whereas and I'll give you an example. I wear my Apple Watch, and I was putting a chair together and I was banging the chair, and my watch said, "You look like you have fallen. Do you need help?" Well, that's a great piece of technology, you know, and I think that we need to provide older adults with those kind of technical supports as they move forward, so that there are some assistance or assistive devices to help them. But for the aging population, I don't think technology will ever or should ever really replace the impact of the live experience. And I'll say one last thing about technology is, and I'll use myself as an example. I just had surgery 2 weeks ago, and I have my post-op visit on Monday, this coming Monday, and it's a virtual visit. And I'm really put off by it, because I keep thinking my surgeon doesn't need to see, like, you know, I don't think that whenever possible, I don't think that a live visit should be replaced with a virtual visit. I think that in many walks of life, technology has gotten almost a little bit too easy. And we cannot forget the importance of that live, whenever it's safe, of course, but of the live experience. So
Absolutely. It's that push and pull of, it's convenient, but is it appropriate in a particular circumstance?
exactly.
Much like a prior generation was, you know, we see how texting versus phone calls is a difference, but it's generational. So it'll be interesting to see how things move forward
Right.
with society's acceptance of Zooming instead of being in person. So 3 million Americans turn 65 every year. And as the baby boomer generation continues to age, an increasing number of people will explore senior care options. What is some advice that you can give to older adults and caregivers looking for quality and affordable senior care? So Donna, do you want to start?
Well, I'm going to be very biased. I think there's no more affordable way of providing for seniors than adult daycare. I mean, what we do in the course of a day is a fraction of the cost of home care, you know, assisted living, you know, nursing home care. That being said, there's a place for all of those things too. So I would never say to somebody not to do those things, but I just, you know, the other thing that I think is very worth mentioning, and I think that we're going to, over time, need more and more support for families like this, is that you see more and more families blending and moving in together to care for their aging family members. And that means that you have multi-generations living under the same roof. And that comes with a whole other myriad of challenges, of wonderful things, but also challenging things. And I think that there needs to be great attention to families that are living in that way. And if you look around, there's so many families living in that type of lifestyle.
Yes, absolutely. John?
Sure. You know, I think there are several different levels, and you know, Donna talked about adult daycare and the medical model, which is a tremendous benefit to everybody in the community. You know, most people who need help with their daily routines, they rely on unpaid care. And that unpaid care, where does it come from? From family members. I know, I can tell you personally that when my mom was alive, the last 2 years of her life were, we tried our best, because she was bedbound. We tried our best to keep her out of the hospital, quite frankly, out of a nursing home. She unfortunately couldn't, go to adult daycare. So I know myself, it gave me a much keener appreciation of what family members go through, and certainly, caregivers professionally and personally, what they go through, because I know that if that my experience is a microcosm of their every single day, and that is amazing work that they're doing. It is amazing work. So what I would say is, if figure out the level of care that your loved one needs, right? And if it truly is beyond the scope of the family cobbling together care at home, then can that loved one go to a place like River House, like Donna's place, right? Can they get out and can they go? If they can, that is a tremendous benefit. It's great. It's socialization, it's care. It's a lovely setting. If not, then you've got to assess their home care needs, right? Evaluate the kind of help that they need. Whether it's healthcare or personal care or household kind of care. I think it's really important for family members and loved ones to figure out what kind of care their loved one needs, and really consider that, because you may not need. It may be easier, right? If you say, you know what, maybe you're the only child and you can't take care of, excuse me, your mom, your dad, your aunt, your uncle. If they're mobile and they can get out to daycare, then it is a great alternative. If I won't get into all of the details, but if it's independent living or assisted living, if they can do that, that's wonderful. Clearly, I believe, ironically, probably, that the best thing is to you don't want to get to the point where you need a skilled nursing facility. If your loved one can remain at home, I believe strongly you should do everything that you can, if it's in your power, to keep them at home. And if you can't do that, then you've got to figure out, okay, what's the level of care that they truly need to thrive, and not feel engaged and not isolated. And I think that, again, that takes a family. If you've got siblings, if you've got friends, it does really, that saying is a cliche, but it's a cliche because it's true. It really does take a village.
Yeah. And I would imagine also there are some organizations that offer multi-level care, which I always hear is a very nice seamless transition for the client, given that it's familiar surroundings and maybe even familiar staff. So that's also something to think about.
Mm-hmm.
So we know that the town of Greenwich is getting older. Although maybe during the pandemic with all these families with young children, that may be changing now, but it's too soon to tell. So, there are a lot of discussions about affordable housing in Greenwich. We've had an entire meeting dedicated to that. And I was just curious what your thoughts are on making senior living options more affordable for our residents.
Yes. So I think, kind of dovetailing, excuse me, what you were just talking about. I think one of the things that we're exploring is skilled nursing at home, which is a higher level of care than even home health care, for example. And I think it will end up being a much more affordable alternative to going into a skilled nursing facility. Plus, then that person gets to stay in their home and hopefully be surrounded by family, as well as the clinicians that they might need. So that's something that we were most definitely exploring. There are a lot of regulatory considerations for that. So that's a long range plan for us to provide skilled nursing at home and get out beyond the four walls of the actual nursing home. I think that will provide a real benefit to our community at large, and the family members that may not need it now, but will need it down the road. Because as you say, nobody's getting younger. We're all getting older. So I think that in itself will be a huge benefit to the town and the surrounding areas. And also, Nathaniel Witherall we have 5 units in the pavilion on our campus that is well below market rate. And I believe that municipal improvement, there was status conferred a couple of years ago for a 52-unit apartment building for older adults. I think from what I've read, that was going to be called Vinci Gardens. It was supposed to be built in Byram by Greenwich Communities. That's a nonprofit that uses financing and public funds to help low-income families. So I know that that's still ongoing. The approval for that some have opposed it in the town, but I know that also there was a pre-application for a 52-unit building that was submitted to planning and zoning in 2021, in the summer of 2021. So from what I've read, Greenwich Communities is really very supportive of, and is likely to be one of the receivers of some financial support from the Affordable Housing Trust Fund. And hopefully that gets done, because it is sorely needed.
Absolutely. Thank you. Donna?
Sure. Just to feed off of, I agree 150% with everything that John just said. I serve on the Age-Friendly Greenwich Task Force, and I chair the Dementia-Friendly Greenwich Task Force. And much of our focus is on making sure that Greenwich is affordable and remains a town that's filled with resources. And I can't stress enough how rich Greenwich is in resources for all. And by that, so for example, affordable housing, low-income housing, as new units are built or are renovated, people need to shift the paradigm just enough to understand that if you're really creating an age-friendly unit, make space in that unit for there to be a long-term caregiver, albeit a family member or a paid caregiver. But many of us will continue to age in our homes, but will require home-based care in order to do it. And there needs to be ample space for people to be able to live there and live there legally. Public housing, for example, senior housing, you can have somebody stay with you, but it's short-term. They can't permanently stay. Well, it needs to be long-term, because we can hopefully be aging for a long period of time and need that level of support. Really, very much of what we're talking about is affordable and low-income housing, because people who have their own homes can make those renovations. And I talked about blended families, and there are people who have the means to be able to make those adjustments as they need. But we're talking about affordable and moderate to low income housing, and those structures really need, and there is much discussion. I don't want to say it's not pie in the sky. It's in the works. It's being talked about all the time, that as new units are built, units need to be built so that there is space, the right space, for a caregiver to remain in that unit. So I feel like we're slowly, it takes time, but we're moving in the right direction. And I can't say enough about our town, because look at all of you who are on this Zoom. I mean, everybody's working towards the same cause. And I think that's the magic of Greenwich.
Absolutely. And that's why we hold this meeting every month, so that partners can join together and work together to solve the issues that we're confronted with.
Yeah.
We have only a few minutes left, so I can give each of you 2 minutes to share anything that you want to make sure we hear from you. And then I will announce a couple things and we'll conclude the meeting. So John, do you have anything?
Sure. So I did mention our, excuse me, our SNF at home initiative. And again, that's a long range project for us. Just so folks know too, what we're also planning is we're currently working with a large national provider of hemodialysis and peritoneal dialysis. And we do plan on offering in the coming year a center of excellence at Nathaniel Witherall, which will be a dialysis den. So the benefit of that, and we're really excited about that. The benefit of that is that folks that we now have, residents that we have that go out to dialysis, they've got to go through the transportation, the very draining and exhausting visit itself, the treatment, and then transported back again. And by the time that all happens, their day is shot. And so it's really not only a clinical issue, but it's a quality of life issue. And we looked at that and said, wouldn't it be great if we could provide in-home dialysis? So that's what we plan on doing, as I said, in the coming year. And that'll be a great benefit to not only our current residents, but residents of Greenwich and outside of the Greenwich area to come to Nathaniel Witherall, and they can get their dialysis right then and there in their own home. That's something that we're really very keen on and excited about.
Fantastic. Thank you. Donna?
I'm first of all, thank you. Thank you so much for allowing me the opportunity to be part of this meeting and to talk about these really important subjects of aging in Greenwich. I hear time and time again from families that I didn't know about you, or I didn't know that there was this service or that service in town. And I would really just want to encourage us all, myself included, to reach out to those who perhaps are alone or have limited resources, and just help to connect them to any one of us. Because if we don't provide what they're looking for, we're tuned in and we know what the other resources are, and we can certainly help them get what they need. But it continues to break all of our hearts when we hear that there was somebody who was alone who wasn't getting what they needed. And when we have so much to offer in the town of Greenwich, that's a tragedy. So, let's continue to work as a village and reach out to those who are perhaps isolated.
Thank you for that. I wanted to make sure that for those interested, there is a wonderful book by Atul Gawande that I've mentioned before called Being Mortal. It both takes you through a very accessible, he's a medical professional, a very accessible way of understanding how the body ages and which things go first in a general sense, and also about cultures, about moving in to your parents' home versus bringing them into your home, and how senior centers began in America and just the different cultures. So it's quite fascinating. I recommend it. I want to thank Donna and John for not just their time today, but really their time every day. What you do is nothing short of miraculous every day, not just with the challenges that you're facing as of late because of the pandemic, but because what you do is so vital and so important, and frankly, for a population that sometimes is often overlooked, but that, they're the pioneers of our town, they're the elders, and we should be respectful and honor them in every way. And we're very thankful to have the two of you and your organizations and staffs doing just that. And so I just wanted to say thank you and appreciate you and your work. And thank you everyone who joined us this morning. We look forward to chatting with you next month, and have a wonderful week. Stay safe tomorrow and every day. Thank you.
Thank you. Thanks so much.
Thank you.
Bye-bye.
Bye-bye.